there are better ways of doing it. Now, these traditional bone setters, can't they get such opportunities and then become part of modern medical advancement?
Yes, they can. Just as I was trying to reiterate, where National Orthopedic Hospital took it upon herself to get the association of these people and get some of them and put them in batches and train them for 3 months. Simple cast management, training them to know their limits and when to get this patient off their hands to the next referral level. But you know what most of them did with that certificate they got? They took it back to their office, they framed it, pasted it over where it's very conspicuous in their offices, and they kept using it to advertise, telling patients that, you see, even Igbobi is begging us to partner with them. by the time this information came back to you, that program was stopped.
Oh dear.
Do you understand? You want to, when you are seeing complications, the way you prevent complications is to go to the source and prevent it. And a lot of people have suffered 1 or 2 hands from them. But you can't speak up. You can't talk. You can't arrest them. You can't do anything because they threaten, they will kill you.
Yes, but then I also do know that there's this issue of chemists mix drug for me, and then we've been preaching against that. Go to a proper hospital, get proper diagnosis and tests, and then proper, recommendations from a qualified doctor, and then to a pharmacist. These are the drugs you give to this person, right? But we still have Baba Miss drug for me, and the chemist and all that. And then people are still dying of typhoid and then malaria,
yes.
That kind of thing. Is that not the same situation too with the bone setting issue? I mean, because I and the producer were mushing. I remember where we witnessed, we were trying to cover this bone setting thing, and we witnessed, one of these people, or these bone setters, break the chicken leg, and then he's treating, one young man, and I mean, isn't that ridiculous?
It's really, really ridiculous in this jet age where the world is a global village. Somebody wants to be living in stone age, and you see, the people I blame are the people that goes there. When one is injured, everybody around tells you there's a Baba next door, and they take you there against your wish, even if when you're unconscious. And if you come back to your senses, the onus is on you to get up and leave that place. Not say, the man is collecting 2,000 naira every two days, and at the end of the day, you spend more, you don't get anything reasonable. And even if the fracture unites, it usually malunites. After some 1 or 2 years, you come back to the hospital to repeat those same procedures you've been trying to avoid. And this boils down to the vicious cycle of disease, which is poverty, ignorance, and disease. The average Nigerian does not think you need to pay for the services of a doctor. They say, when I go to the hospital, I open case note, I pay to see doctor, they write prescription, I go, let me just go to the chemist. The chemist man, most of them are not pharmacists. And even pharmacists are not supposed to sit down in their shop and be diagnosing and treating as if they are hospital. They are to dispense drug prescribed already. Do you understand? So people want to do a shortcut, and when they leave, they go there, they miss Orishi to swallow whatever the complications. They run to us. At that time, people barge into my hospital at 1 a.m., 2 a.m. that they are afraid they will die at home, and you do everything. My philosophy is this: no, don't ask for money, keep that patient alive. Then the next day they are alive, they start telling you they want to go as quickly as possible, and you cannot, medicine is a thing of, I need your consent to treat you, and if you don't give me that consent, there's nothing I can do. The case note is important because of litigation. Some come back and they want to blame you for things they have spoiled already, and the patient
Dr. Nixon will have a caller. Yes, there. Who's there?